Good morning, viewers. Welcome to Frankly Speaking with Vibhuti Jha. You know, it is hard to believe that we are still tackling the coronavirus thing. And it has been more than a year. I have been doing this show from my home office. And the last I did was more than a year ago. But it is remarkable that how this particular virus has sustained for so long. The date count of cases in US, India, and the world reads something rather menacing. 3.42 million cases around the world. And, it is so tragic. 3.42 million cases around the world. And, India has 25.8 million with 287,000 cases dead. United States has 33.1 million and 587,000 people dead. 300,000 more than India. And India's is despite the second wave of the whole thing. In the world, it is, there are 165 million people. Is that so, doctor? 165 million cases and 33.42 million deaths in the world around today. So that's truly sad. That's something, the disease has impacted the world we know. Trillions of dollars have evaporated from the market. Lifestyles have changed. Real estate market has changed. Working patterns have changed. Sociological shifts have happened. Psychological profiles have changed. What not and everything has happened in this. To discuss the entire ramifications of it, the new steps that are being taken, the leadership went crazy everywhere in the world because nobody knew how to deal with this. There are very interesting pointers to that. We'll come to that. But I have great pleasure in welcoming Dr. Rakesh Sharma once again, because he and I have been in conversation just about the time when it was declared as a pandemic. We recorded the show in the studios. And the last time we met was on 17th of September last year. We talked in the studio about the advancement that it had made, but the numbers were remarkably less. But the US was bursting through the seams, just as India is bursting through its seams in the second wave. So, Doctor, welcome to the show. Dr. Rakesh Sharma, welcome to the show.
Good morning, Mr. Jha.
Yes, and thank you very much for coming over. You have been in the absolute forefront of the battle against coronavirus, not only as the chief of medicine, but in charge of a 40 plus bed ICU in Smithtown Hospital. So tell us, where have we arrived today? I'll throw a very simple question. Where are we today with reference to mask, no mask, 6 feet difference? What do people, does the average person know anything about it? Because the confusion from the politician is rampant. And I don't think Dr. Fauci is helping either, because his statements are completely contradicting himself the previous day. So make our life and make our day.
Okay, Mr. Jha, thanks for the invitation. As you recall, first time we discussed COVID-19 infection was January 2020. And last time we had a show was in September 2020.
Right.
A lot of things have changed in the last 17, 18 months. Sorry. As we know, in US, the first state that was attacked was Washington State, or precisely Seattle. Then it came to New York in March of 2020, first week of March. And now, so many months later, we are finally taking some sigh of relief. But when I say sigh of relief, that is after close to 600,000 deaths in United States alone, and more than 3.4 million deaths worldwide,
Right.
and close to 300,000 deaths in India. If that figure is correct,
Yes.
I think the figure is more than 300,000 deaths in India from COVID-19. And Europe itself had 1.1 million deaths from COVID.
Right.
These numbers are very shocking in today's date. Of course, when Spanish flu came in early 20th century, many more people died. But that's when there was no healthcare system. In today's date, more than 3 million people dying from a viral disease worldwide is very shocking, which tells us that no matter how much progress we have done in healthcare system, uh, we haven't done enough. When we look back, the Western countries or more developed countries have suffered much more than uh, struggling countries or poverty-stricken countries. In Africa, the total deaths have been less than 50,000 in entire continent of Africa, which has almost same population as that of India, close to 1.3 billion people. So poor people or poor countries suffered much less, and economically better countries have suffered a lot. So that is a mismatch of this viral disease, and the reason could be that more obese you are, more diabetes you have, more risk of dying with COVID-19 infection. So my observation has been since April of last year, after we started to know the disease, that most of our patients in ICU who were struggling to survive were either obese or diabetics. And that phenomena is being seen all over the Western society. And I think that may be the reason why Africa did not suffer that much, because of no obesity there, or less obesity there. So that is a little bit of epidemiology and the higher prevalence of disease in certain age groups. And of course, as we know more and more as the time goes on, we also realize that the transmission of COVID-19 infection is directly related to the viral load of the person who is sick. How do we transmit the disease from a sick person to a healthier person depends on 2-3 factors. First one is the viral load. The person who is sick, how much virus is he expelling in his breath, in his cough? That's number one. And number two, what time of his disease he's exposing other people. And we have found that when the symptoms start in a person who gets infected, that is the worst time for that person to be close to anybody else. So as soon as someone is having fever or cough, that day and next 2 days are the worst time for that person to be close to anyone, means household people and the friends or workers, co-workers. They are the one who get exposed at that time, because the index case or the person who is sick is not that sick. He perhaps doesn't even realize at that point that he's sick with COVID, and that's when he is spreading the disease. And that's why you see in India these days, in household, almost everyone gets infected once one family member is infected. So that's one factor, the timing. Number two was the viral load. And number three is some effect of the age. Older the person who comes in contact with a sick individual, more is the risk of him or her to contract the disease. So those are the things. And we also think that masks help. When I say we also think, because so far there has not been very concrete proof of that. There have been 2 studies done. When I say mask, this is like people who use the mask the way they use it, or self-mask people. So it has been shown that unless you are a healthcare worker who knows how to use the mask, or general public is using the mask perhaps either in a wrong way or not continuously on and off. So when they use mask in that way, they are really not getting good protection. A couple of studies have shown that. So you really need a mask which is multi-layered or very surgical or N95, good quality mask. I think just putting a cloth on the face is not going to give you protection.
You mean to say that the mask generally people wear, the blue thing, blue white thing, that's all bunkum?
That's what I think is not giving enough protection. Yes, it will protect you 30, 40, 50%, but not 100%. And that's why you see the infection has been spreading very easily. When we say 3.4 million people died world over, I mean, number of people infected with the virus is millions.
Yeah, millions.
And a lot of us have been wearing masks. Not all of us, but a lot of us have been wearing masks from the time USA was, attacked with this virus.
Right.
You can see how many people got infected in US alone. So mask has to be used properly. Otherwise, you're really not protected.
Wow. I mean, let me tell you something, and I don't mean to flatter you. I'm paying you a compliment. That your words, the way you explained, made so much sense that I think you should replace Dr. Fauci when it comes to speaking to public about the disease and how to use the mask.
I've been waiting for that phone call from White House, but that's okay.
No, because you really made you created a differentiation between fantasy and facts. That's important.
Yes.
Because what people are looking for is assurance that there is no, everybody is fearing it, right? Right in the beginning. I mean, I remember when the whole thing started off, I used to put a hanky. There was no mask available. So you go to Whole Foods, you go to Shop and Stop, and you put the hanky around you, just as we used to do in India for whatever reason.
Sure.
Point of the matter here is that there is so much of insufficient information, and that brings back to me to a very interesting element. Now, we talked about the healthcare facilities. People have been trashing India left, right, and center, notwithstanding how India coped with the first wave of the entire virus, right?
Yep.
So much so that India created the vaccines, was happily exporting vaccines to 80 countries in the world. India became the example of the COVID warrior. And lo and behold, here comes the second wave. And now India is a joke. Everybody from media, somebody forwarded me how 11 publications, newspapers and business articles were condemning India for not handling the cases properly, not recognizing the fact that US went through US's first stage was perhaps what India's second stage looked like. Because New York, California, Bombay, Delhi. If New York, California of the first stage was utter disaster, even though the Governor Cuomo got an Emmy for that, what I do not know, but he was given an Emmy award. Whereas India's second wave is killing the country, again, politically speaking, not medically speaking. Again, there are a group of 5 states which are not run by the center of
the
power.
government.
Right, exactly. The same thing happened to Trump here. The same thing is happening to Modi there. And today there was a very funny news that when people were talking about Modi giving vaccines to other countries, he says, "Apne liye kyun nahi rakha? Dusron ko kyun diya?" And today Times of India carries a news that poor people of poor countries are going to suffer because India stops exporting vaccines. So do you are damned, don't do you are damned. There is a serious political play here, and that translates into another assertion. In US, healthcare is remarkably good. You know that. You are part of that process. Per capita availability of healthcare is so much better than India. But both these countries are hardest hit. Why do you think so?
US, I can understand initially after Europe was affected with COVID-19, or I would say Italy, it came to US. And as we all know, country was not prepared. So in March 2020, USA was not prepared at all. They didn't even have enough masks for healthcare workers. They didn't have enough ventilators. Fortunately, our healthcare system has been quite strong. We did have enough beds for the patients, thank God. Uh, but why USA was affected a lot, I think because there was no central direction as how to cope with COVID-19. President Trump, who took the lead, made a couple of mistakes. He chose Dr. Fauci as his point man. And if we all recall, for 6 weeks or 8 weeks of COVID-19 infection in USA, Dr. Fauci kept saying that masks do not help. So public was totally confused whether to use mask or not. So when you start with that kind of confusion, it's very difficult to eradicate it later on. So if you went to southern part of United States, in Texas, Alabama, Mississippi, people totally refused to use masks, saying that Dr. Fauci doesn't recommend it. On the other hand, in New York, we saw from day one, when New York was hit very bad, that everybody started to wear masks. Later on, this confusion kept going because CDC, Dr. Fauci, Trump administration, and media, they all were giving different messages. So that was the major factor why USA was hit very bad over the next 2-3 months. And India, as far as I can see, sitting from here, in first wave, they did very well because of total lockdown of the country. And then it was like premature victory. Premature victory reminds me of President Bush when he flew on the aeroplane carrier and said, we have achieved victory in Iraq. And then we found out for next few years, America was actually fighting Iraqi public and forces. Same thing happened to Modi government, declaring victory a little too early. People lowered their guards, governments were relaxed, and restaurants, shopping malls were opened. And I think India suffered because we became very laxed about it. And only in the last 3 weeks, when people saw the country suffering a lot, they have been self-quarantining themselves, or everything is almost
In
locked down.
India's case, it is also more than obvious that people, unfortunately, took it that it was over. You are absolutely right about the premature celebration, that we have contained it. And as a result of which, and because India had also developed the vaccines and the cases were low, so people became careless as well. So you are right, people began to socialize. And the important part that you mentioned, that the load factor and the initial stages of how much they were discharging, and that's why families have been hit hard. That's why it has happened that if a person was infected with the disease, even the immediate family got hit. So
Right.
I know of a very dear case of somebody I know personally. The whole family had COVID. Everybody survived, but one the senior most gentleman got it and he passed away. So the point of the matter is that it became infectious with everybody else. Now here is the important part. I notice on the in the program, because I want to find out, because I'm a believer, and I said this in the program earlier on also, that for petty crimes, people spend time in jail, go to prison. This is a crime of a massive proportion, if it is a crime. So let's be very clear. Where is the evidence to suggest that what happened here? I'm referring to another article by Nicholas Wade. Have you come across that article?
No, I have not.
Oh, I'll forward it to you.
Okay.
It has come in the Bulletin of Atomic Scientists. And Nicholas Wade has made an assertion that yes, origin is uncertain. But he also questions, is it really uncertain? And he throws two questions out. One is, it was nature born. It was happened because of the transfer of from the animals to the human. So, he was talking about the fact that, it jumped and transferred from animal to the humans directly. And that, based on the evidence and data, that didn't happen with reference to this virus. But there is enough data available with reference to SARS-1, MERS, and everything else. But this particular data, that it has jumped from people to animal to human, that is not coming out. So the most likely scenario looks like there was some kind of a biotesting was done and the virus escaped. He also refers to another element, that just as smallpox virus escaped from London labs in the earlier stages of 50s and 60s and 70s, so this virus escaped. And he gives a case, makes a case that the lab testing conditions in Wuhan lab were not maintained to the required standard. And he talks about the fact that this was the gain of function test in which somebody was trying to find out that if a SARS kind of a virus came again and became a pandemic, how can the virus be controlled? It was a controlled study, but there was a very interesting point he makes, that the cost of doing this far outweighed the gain. Because what happened was the testing was done on what I did not know. The first time I heard about that concept, on the human mice, they said it, the mice with human elements.
Uh-huh.
That's where the testing is done. And it had become completely armed because it was already tested. So once this virus was out or escaped through Dr. Shi and others who were studying this became a problem. And then all hell broke loose. He also mentions there that Wuhan lab is the place where it all happened. He also makes a statement that National Institute of Health, through its a sub-agency, allergy and other places, they gave money for this testing.
Sure.
So the joke was that Chinese tell the Americans that, why did you spend money to do the virus testing in my country? And American tells him, hey, you are stupid, you let the virus escape. So it's a sad part, but this is the truth about it. So your thoughts on the natural versus the man-made part of it. There is a general consensus around that this is a man-made crisis.
I think...
If you don't want to answer the question, please don't, because you are a responsible doctor. I don't want you to put
we don't have any evidence or proof. As we all know, no scientist has ever come forward, say, this is exactly how it happened. There have been a lot of theories. Mm-hmm. We all know it came from Wuhan and from the lab in Wuhan. Now, whether it jumped from animal to human,
right,
is very difficult to digest. I think this was not created in the lab, but extracted from the animal and was being worked upon in the lab.
Yes.
Now, whether it leaked accidentally or somebody did on purpose, we don't know. But I can tell you that China contained it very well. They didn't have any fatalities outside Wuhan except very small number. But from Wuhan, lots of Chinese workers went to Milan area. And that's where they have a lot of leather factories. And that's how it was transmitted to Europe. And now, if this was done intentionally or it was carelessness, none of us will ever find it out. The WHO went there months later, and when they went, they didn't even actually go to the lab itself. They just spoke to Chinese scientists and government officials and made the report. And American scientists have never been allowed to go inside Wuhan lab. So besides that, whether it was done intentionally, accidentally, or whatever. I think enough damage has been done
Right.
for almost all the countries, and more than 3.45 million innocent people have died. And despite that, you can look at the students, small kids who have not gone to school for a year.
Right.
Colleges have been shut down. Some programs either had no semester or they had semester online. I know some medical students, I know college students. I mean, this is a big disaster that we have never seen in our lifetime.
Right.
But now the question really comes, how much work did the governments do to protect its citizens? And I don't want to blame Modi government for whatever is going on in India. But coming back to India, I feel quite bad that poor people are suffering more than the others, and lower middle class is suffering like anything. And since we don't have a good healthcare system in India, you have been left on your own to find a hospital, to find a doctor, to find a bed, go and get your own medicine, and have tons of money if you want to get treatment. And even after all that, you may not get a hospital bed, you may not get oxygen. I mean, I have never seen anything like this. That is a part where I blame the government or the officials, but I also blame Indian citizens. I think it's a shame that in this kind of crisis, people are trying to make tons of money by selling hospital beds. The doctors who are charging money for online consultation, amount that is very shameful. People who are negotiating with general public to get them beds in the hospital with some fee. The drugs that are being used, being sold in the black market, and people are paying 5-10 times the price of that medication. And some of the drugs that don't even work at all are being given left and right. And also, I'm a little bit puzzled and shocked that most of the Indian doctors, I'm not saying all of them, but most of the Indian doctors are treating these COVID infection patients in a way that nobody does in United States, giving them a prescription of 10, 12 medications, not heard of, things that don't work, are being asked from the patient or the families to go and get from the pharmacy. And tons of blood tests and CAT scans are being done. And I'm just shocked that don't we have some kind of supervision in India? What has happened to all the government officials that it's a wild, wild west in India? And I'm sorry to use these words, but that's the reality.
No, this is really a sad reflection, and there's nothing. That's what I'm trying to say here. That we have here in the U.S. a robust system, healthcare per capita availability, and that's how you, as you rightly said, that even though there were no drugs available, at least hospital beds were available, and they were made available. New York State and California were provided Navy ship with 10,000 bed capacity, right? So the point of the matter is that they were provided capacities, that it was only 1,000 used and it was let go, that's a different matter. But the point is, in the case of India, we know that infrastructure in India has been a perpetual problem. And infrastructure of any kind, whether roads, bridges, and everything else. So India has been trying to focus on infrastructure development. Who knew that this pandemic will expose the stress and strain, the chaos and confusion that the healthcare practice went through? Nobody knew that. And this is the important moment. Like I always say, and you are aware of that every disaster offers an opportunity to redo things. And I think this is the time for India to take on certain things on a war footing. The healthcare is absolutely the basic minimum requirement of a country. We talk about everything else about health, right? Our literature, our Ayurvedic thing, our everything else provides towards better health. We talk about that all the time. But there is poor hygiene in India. You and I know that how the trash is thrown around, right? Kachara phek diya, like our homes are clean, but all the kachara is thrown on the street. That's part of the way we are. But I'm coming down to the other element that I will forward you that article of Nicholas Wade after this.
Sure.
Please do read that because it taught me a lot of things. So I'm not going to talk about that article, although I made notes from it, but a couple of things were very interesting. And that interesting thing is that how did China control this entire death? Why didn't China share about what they did to control the virus? That's a mystery, right? That nobody knows. The other part which he talked about, he talks about two theories. One is he says that the lab testing, the way it happened, was full of fault. Apparently, these lab testing are done from what is known as BSL1 to BSL4. And BSL4 stage, if you are in that stage of testing, you are virtually wearing a spacesuit. And the testing becomes very slow because it's so cumbersome. What they said was all the work that was being done with this virus was done at BSL2, which he again describes it, is the arrangement or the safety standards of a dentist clinic in the United States. And that's how people got infected. And once they got infected, it was no holds barred. Once they figured it out, they shut down the whole thing in Wuhan, as you rightly said in the beginning. And then it went over because everybody was allowed to leave and travel all over the world. The world did not know. China concealed information from the world that it was human to human transfer. It was not natural, configuration from bat to humans. That's a very interesting observation. And he also blamed a couple of things. He talks about a very interesting information. He said that in February 19, 2020, group of virologists condemned the conspiracy theories, saying that it never happened in a lab. Virologists. Then he also said that he mentions a name, Dr. Peter Daskal. He's the president of Eco Health Alliance. He made a statement, I'm making this a statement, he has interest in the lab. He's an American. Directed the money from the National Institute of Health and whatever the subsidiary is to them. And he made a statement, we have no conflicting interest, but there was conflicting interest. Then you have a scenario that on March 7th, 5 virologists gave the statement, there is no lab construction or purposely manipulated virus. There is no evidence for that. He points out these factors, and that's what is important to bear in mind, that while the evidence will come later, the evidence is gradually pointing out more towards the fact something went wrong. And as the saying goes, until we have full evidence, we can't prove. If the famous OJ case, if the glove doesn't fit, you have to acquit. So the challenges of that kind as to how China has just about 1 million cases and just 50,000 deaths or much less. How did China not share the information? I don't want to burden you with the political elements, but should you want to say something, please go ahead.
Yeah, sure. I think from all the information that I have, when Chinese found out they were having an atypical kind of pneumonia in Wuhan, so they knew this is something new, some kind of viral disease. So they contained it by isolating these people. And they followed every contact that these patients had with, and they didn't let people of Wuhan leave Wuhan. Mm-hmm. And I think we all knew this in March or April, but what did we do? And I'll be a little blunt here. When we found that we had infection in Seattle in February and then early March in New York, did we start to isolate people? No. Did we follow the people they came in contact with? No. Did we have enough testing? Absolutely not. I remember because I dealt with it from day one. In fact, our first patient in my ICU came on 7th of March in New York. And we could not get testing results back in 6 to 7 days.
Wow.
Forget about the public. After even in late March or April, if you wanted to get a test, you had no idea where to go for the test. If you were lucky to find a site for the test for 5-6 days, you did not get the result back. And that's when you infected more people.
Oh, that's
And you know, USA was not prepared, and the people who were running the show, I don't want to blame Trump administration, because president is not supposed to run around in each and every household or street or every town. State governments failed miserably in United States. No one took charge of their own state. And if Governor Cuomo did something, his actions were also wrong, as we know later on.
right.
So all the other states, even months later, didn't do much. So first wave, you can blame on China or whatever, but second wave or 2 months later or 3 months later, you just cannot keep on blaming China. Yes, they started, but after 3-4 months, what did other countries do? I mean, we had a very bad second wave, not as bad as first, but some of the states, as you recall, few months ago in USA, we were having 4,000 deaths a day. That was months after we started with the infection. Other countries in Europe, in UK, Italy, Germany, same thing in India, same thing. That blame has to be taken by 3 categories of people. 1, the governments. Number 2, medical professionals or healthcare system. And number 3, the public. You just cannot expect government to do everything. As a citizen of a country, we also have some obligation. And people just forgot, and too much freedom. In China, I'm sorry to say, it's a communist country, but they supervised people very closely, and the freedom was curtailed. In USA, you can pick up your car, drive from New York to California, whether you're sick or healthy. Nobody will stop you. And you can keep on infecting people. Same thing in India, same thing in other Western countries. That's why we were not able to contain the disease.
You know, this you talked about the freedom in America and regimentation in China Communist Party.
Sure.
You know, both are different systems, right? So
Absolutely.
we are looking at a total chaos as of now. Nancy Pelosi is asking for mask mandate in complete violation of CDC instructions, right?
Absolutely.
And she's charging penalizing people who are not wearing masks by $500, and many Republicans are in for.
Jack, can I interrupt you here?
Please go ahead.
And I'm just shocked that CDC made this kind of irresponsible statement. We all know that even after you're vaccinated, you have 8 to 10% chance of getting infection, even after 2 vaccines.
Right.
And this is the number, which could be a wishful number. The reality could be 15%. Okay.
You don't know, right?
It could be more. Now, if you have 10, 15, 20% chance of getting infection after getting fully vaccinated, why would you not wear a mask? That's number 1. Number 2, only 40% Americans have been vaccinated so far.
Right, so far.
So
yes.
there are 60% other people who have not been vaccinated. So how can you tell people that because you are vaccinated, remove your mask? Because 60% people can still give you infection.
Right.
So I don't know why President Biden made that statement a week ago and why CDC made this kind of statement. I think it's so irresponsible. As a doctor, I'm shocked that politicians run medical suggestions. It's like me as a doctor should tell politicians what to do in the Senate and in the House of Representatives. I think they
Perhaps
will
we
laugh at
should.
me.
Perhaps we must.
Yeah.
Perhaps we must. It's time for people to acquire that right to say that you are wrong. That's what is a problem. But here is very interesting thing with Nicholas Wade article. I'll send it to you. He says four groups of people are to be blamed for this state of affairs. One, he says Chinese virologists, gain of function in BSL-2 level of safety and security standards that allowed the virus to escape. He blames Chinese authorities for suppressing information that we talked about, did not share the information with the rest of the world. The fact that it transferred between people to people contact, it was not in the air. They'd suppress that information. Still, people don't know what the hell did Chinese do to control the thing, right? It's secret. Third one he talks about is no virologist from anywhere in the world condemned this particular research the way it was going on. He gives a very interesting reason for that. He says majority of the medical professionals get the funding grants from their parent bodies and the institutes of health and the government. And unless and until they toe the line, they don't get the money. And as a result of which, the entire virologist group of people, they just kept quiet. They didn't say a word. But they knew what was going on. It is impossible. His assertion is, it is impossible that people didn't know what was going on. The fact that they did not oppose it was because they were fearing that their money, their supply of money, their grants will be choked for future research. And there was a very interesting thing. One doctor in Himachal Pradesh mentioned, he was referred to as the virology expert. He said it is true because we also lose our place in government recognition. Where do we medical professionals get recognition? Apart from our degrees and certifications, we also get eminence when the government recognizes you. You know, as an eminent physician, they appoint you to the board, they do something to you. So they all seek that. And that's the reason why he blames. And finally, he blames the US role. And the US role, he talks about the funding that was provided by a certain group of people to create and do the analysis of there is a very interesting word used there, I don't remember exactly, is to make sure that the SARS or MERS kind of a virus doesn't attack again. So you create a virus. This is in the movie Mission Impossible 2. I would urge viewers to watch that. Theatrics aside, watch the movie. You will probably get a pretty fine grip on how the game was played. Let's talk about, in the few minutes that we have, let's talk about what's happening in the country around us right now with reference to the 100 days of Biden. I'm seeing complete transformation. Gas prices are up. This is very bizarre. The one thing which struck me yesterday, that the first thing that it issued the executive order canceling that Canada pipeline, right? 10,000 jobs were lost. Now today, US has approved the Russian pipeline. And he says Russia had nothing to do with the attack on our oil pipeline system. Just imagine if Trump had said that Russian didn't attack this, or I'm canceling the EXO pipeline in the US, but I'm granting Russia a license to do the pipeline in that part. What world are we living in right now?
A world full of chaos, where no one can be trusted. And that's a sad part.
Yeah.
There was a time when presidents were trusted blindly. There was a time when media was trusted blindly. Walter Cronkite, if he made a statement, people believed him. He was considered next to God. And now you can look at the media. Last thing people want to watch is news, because there's really no truth in news. And one good thing that President Trump did was to push pharmaceutical companies to make vaccine in a very short time, and then to approve it, and also approve certain drugs or medications to be used in COVID-19 infection. Uh, and that was good thing done by President Trump. Of course, President Biden got all the credit. When he became president, vaccines were easily available, and so he could give you some kind of promise, 100 million people in the first 100 days. And I think President Biden was quite aggressive. So I will also give him good marks that he was quite aggressive in vaccinating people. There are some people, 30-40% in this country who are adults that don't want to take vaccination no matter what. So that will be something bad for the society, because they can create a source for future infections and also for variants of COVID-19.
Right.
Coming back to India, I just want to say, people said why India exported vaccines when they didn't have enough for their own population. I think that was a very small number that they actually exported, 60 million, which would not have done much, because right now only 10-11% people hardly have been vaccinated in India. And even if there were 60 million doses more, would not have done a miracle. I think India made some miscalculation. They should have allowed a lot of other pharmaceutical companies to mass produce the vaccination, knowing very well that they need at least 1 billion injections, if we don't include people under the age of 16, quite a big number. And that's where they went wrong. And also they should have given it at a very fast speed, not over a period of 2 years. And so I just want to mention that to the viewers, that it's not a small job, but when your population is 1.3 billion, you cannot go at a slow pace.
Sharmaji, there is India, nothing happens in speed.
Yeah.
We know that, like everything is a big 1.3 billion dilemmas.
Yeah.
I won't call it a problem. India's population will be a scary proposition for any country in the world. And, everything becomes a challenge.
Yep.
Everything is a challenge in India, whether you do it or you don't do it. Either way, the country is in a chaotic scenario with reference to the opposition people who also create the political climate around the world, that the press media and opposition is being crushed. While they will do whatever they want, they will tell the media, global media, that we are being crushed. It's a very, very tricky country to run. But I have hope. I'm a quintessential optimist guy. And I believe that every disaster throws up an opportunity. And I think with this, Prime Minister Modi will know exactly what to hit on, and how to stop the chaos. But one thing is definitely true in India. There is a general awareness in people about responsibility. And in my favorite phrase is, we non-resident Indians are not required Indians. We are the new responsible Indians, and every Indian needs to become a new responsible Indian. And that's the India side. Here we are facing a different challenge. We are being attacked. I did a show today that are Hindus facing an existential threat? And in my opinion, yes, that will be a conversation for another day. And thank you very much for joining today. Thank you, viewers. You want to have a last word?
Yeah, can I just say
Please.
something? Your program may be watched by Indians later on, some other day. I just want to tell people that we don't have any treatment for COVID-19 infection. When I say we don't have treatment, believe me, 8 out of 10 medications that are being used do not work. And I will include all the biggest names that are around, whether it's remdesivir or what we call Actemra in USA, and it's called tocilizumab in India. That's a generic name. Plasma, and all the big guns that is being used, they do not work. If remdesivir is being used, does it really work? Very controversial. Only thing you have is oxygen and steroids. So please, instead of looking for a treatment, pay attention to the prevention. Got to have total preventive measures taken. If you or your loved one is sick, please stay away, isolate that person, cover your face and nose, and stay away from people who are sick. Don't be a hero. And prevention is the only thing. If you get a chance to get vaccinated, please get vaccination because there is no treatment for it. So that's the last word I want to
Thank
tell
you.
you.
That's the important bit. Nobody, I think there are times in a critical moment we understand the meaning of the phrase better than ever before. This is the time to take home the very important lesson. Prevention is better than cure. And this is the time to apply it fully in your lives. So thank you, viewers, for joining us today. Have a great weekend. Be well, be safe, and see you again next week.